Good morning, everybody. I hope you had a wonderful weekend. This is Monday the 14th, and welcome to our daily COVID meeting. We're going to start this morning by taking a look at all the hurricane-related activity out in the Gulf and the Atlantic before we actually delve into the COVID numbers. So let's go directly to the whiteboard. You can see that Hurricane Sally is expected to make sure this later this evening, first thing Tuesday morning, and it looks to be heading directly into Louisiana. It did come across the tip of Florida over the weekend and has produced a lot of rainfall on the leading edge, which skirted Tampa Bay. So as you know, we had a very wet weekend, but there was no wind-related activity. Very busy out in the Atlantic with tropical cyclones and disturbances. Paulette, Irene, Vicky, and Teddy are the four active storms that we are tracking. Paulette is expected to come up toward the New England states. There is a strong current pushing and steering that back out into empty ocean. And so that's anticipated to happen. Irene is actually headed in a eastward direction, northeastern direction, so that should not be a problem. Vicky is still too far out to give us much concern, but it very likely is going to follow a northward trajectory like Paulette and Irene. Teddy is the one that we're focusing on. You can see it is already a hurricane, and we're just going to continue to see where it goes. If it follows the usual path, it will come up here to the Bahamas, and at that point, we sort of have to watch and see whether it heads into the Gulf or into the Atlantic. So at this point, I just want residents to know that we're tracking this, we're watching it, and we will keep you advised as this continues to develop. And if we have any recommendations, we will be sure to communicate that on 732 and through resident meetings. Okay, so now let's dig into the COVID numbers, and we'll go right back to the whiteboard. So to date, we've had 665,000 cases. Only about 41,000 of those have resulted in hospitalizations. And of that, we've had about 12,000 deaths here in Florida. Come over and take a look at the two charts on the right-hand side. You can see the chart there on the right that shows the number of new cases. It's by day, and you can see a couple of spikes. Those tend to be the days where data is dumped, but overall there is a slight trajectory down. You can see we were well above the 4,000 per day, and we're now down at between 2,500 and 3,000 on an average per day. So there has been improvement in the terms of new cases. The single most important thing that we track, and this just continues to decline every single day, that's the chart in the bottom right-hand side. Those are resident deaths by date of death, and you can see that we are down to really low margins down here. So as the therapeutics are employed and physicians are figuring out how to treat COVID, and we're beginning to get herd mentality, and we're beginning to get herd immunity, we are seeing improved outcomes for the COVID diagnosis. We're going to go next to testing. The chart over here on the left-hand side shows the testing that happened over the weekend. we had about 47,000 people tested. 1,827 were positive and 45,000 were negative. So you see the graph down below, it's running about 3.89%. Again, that is below the benchmark of 5%, and it is comparable to what we would see with flu and influenza. We are beginning to turn the numbers on the right-hand side of the chart around. This is the cumulative data for Florida. We've tested almost 5 million people since the start of COVID back in March. We've had 665 positive, and look at that negative count, 4,275,000. So the percentage of positive tests is down to 13.45 and continues to improve every single day. It's also shown, the positivity rate is shown by the line graph in the middle of the chart. You can see it went down there on 8:30. It spiked. If you go back and remember the chart we just looked at, that was the date of that huge data dump. And then it's slowly been getting back in line for a continuous ongoing decline in the positivity rate. Okay, so this is the demographic data on the update of COVID. You can see right here in the middle on 8:30, again, that's where that data spike occurred that we've seen on the previous two charts. Two things that I think are interesting. The cases by gender, male and female, they look pretty equal. And so it's an equal opportunity to become infected with the virus. The median age of individuals being infected is about 40. You can see the breakdown by age group, and the 75 to 84 and 85. So one of the things that is true about this disease is we had thought originally that these were the highly susceptible, and in fact it looks like the highest rate of incident is going to be late teens into mid-60s. What is, however, true is the proportion of fatalities is higher in this age group than in the lower age groups. All right, here's the demographic data on by zip code, and you can see a lot of the red. Those are the hot zones. Hillsborough County and Tampa are continue to be a hot spot for the state. This little bit of blue, you might think that is Lake Tarpon. That is actually Pinellas County. Pinellas County and Pasco County both are blue and looking improved. These are the four charts we look at every single week. The peach-colored chart up in the upper left-hand corner are the number of people who are presenting in urgent care centers and hospitals with flu-like symptoms. Last week we noted that it was trending upward. This week you can see it has gone fully upward with an increase of about 400 new cases. In the ED visits, this is hospitalizations with COVID-like illness presenting at hospital. You can see that number has dropped from 10,000 to about 4,000 was the latest report, so it's been reduced by almost 60%. Documented new cases on the right-hand side in yellow continues to be a downward trend, and the positive for laboratory testing lagging indicator, so it's documented new cases is a leading indicator. This is the lagging indicator. The graph looks very similar, but the numbers are lagging behind, as you might expect. All right, we're back at the table here. We're going to dig into the numbers for Pinellas County and then specifically here at Regency Oaks. So as we saw, we had about 10,000, a little shy of 10,000 new cases in the state of Florida since the Friday reporting period. So it went up by just a little over 4,000 on each of the weekend days. We saw an increase of about 300 fatalities in the state of Florida over that 3-day period. In Pinellas County, the numbers are very stable. We went up to 20,774. That's an increase of a couple of hundred, and our fatalities only went up 4 to 701 deaths related to COVID since the inception back in March. Pasco County is stable. The U.S. population, we went up about 200,000 over the course of the weekend, and our death count went up nearly 3,000. So continues to be some hot spots across the United States and some areas where they have not gotten a complete handle on COVID and the spread. We are in day 100 of phase 2. The governor originally had planned for this to be a 30-day phase, and here we are in day 100, and the governor has not made any announcement in terms of when he might expect to move to phase 3. As you know, we have submitted our information to be reviewed and are trying to move into the next stage of our phase 2 reopening plan and anticipate hearing something on that early part of this week. We had submitted it last week. We're hoping to have a Friday decision, but did not get it. So I can reasonably expect that we should get that information early part of this week. In terms of what's happening here at Regency Oaks, our numbers are IL. We are in the independent living. We are tracking 18 people who are on quarantine. That number is up 4. All of those are related to individuals who either just moved into the community or were in the hospital and have returned, and both are on loose quarantines. In the skilled nursing community, we are at 9. That is up 3 from Friday. All 3 of those are related to new admissions in skilled nursing. Last week on Friday, we were 0 in the AL. We are 0 this morning as well. In terms of our staff, in the independent living, there are no staff members that we are tracking or have under quarantine. In the skilled nursing, we had 3 on Friday. That number is down to 1. The 2 that we took off were symptomatic and tested negative. So that's good news to share with residents. In terms of our COVID flu-like symptoms, testing in progress. These are people who are actually showing symptoms of either the flu or COVID. And in the IL, we have no residents. In the AL, there are no residents. And in the skilled nursing, there are no residents that we are currently tracking, testing, or have suspicion to believe that they have COVID or flu-like symptoms. Really solid numbers. For our associates, there are no routine suspicions. We do have 110 people in the skilled nursing and 15 people in assisted living. That's a total of 125 that we tested on Thursday, and we are awaiting results. So as you may know, in order to work in the health center or the licensed portion of our building, we are required to test you every single week, and that testing occurs on Thursday. So on Friday, we see a jump in our testing numbers, and then on Tuesday of the following week, as those test results come back, we see a reduction. We anticipate that all 125 tests that we did on associates in our health center will come back negative. In terms of our confirmed cases, our residents are sitting at 8, the vast majority of those being in skilled nursing, followed by assisted living. And our number of associates is sitting at 19. So those are our numbers. I will share one other interesting piece of information. We've had 27 positive tests since March. That's residents and associates. But when you overlay that to the number of residents and associates who have tested negative, that number is approaching 1,300. So you can see where 1,300 as opposed to about 30 of our positive tests, the negative tests are beginning to overwhelm the positive test, and we always have said that the way COVID is going to be defeated is when those who are recovering and showing negative test results overwhelm the number of people who are positive and who are sick. And so we're seeing that here at Regency Oaks, and we're seeing it in the state of Florida and, of course, in Pinellas County as well. Just a couple of other quick things I wanted to talk about. Our skilled nursing visitation. 2 things will happen this week, effective this morning, Monday morning. We have lifted the internal restrictions over at skilled nursing. And what that means is residents who live in either assisted living or skilled nursing will no longer be required to stay in their apartment or their room. They will have the ability to go to common areas, to go out into the corridors, to gather in day rooms and TV lounges and participate in activities. So we're beginning to see those internal restrictions that will lift today. And then we are anticipating that we will be open for visitation later this week. And our target date is the 18th. You have to have 14 days without a positive case. Our last positive case was on the 3rd with notification on the 7th. So sometime on the 18th of the week, we should be able to finally open up skilled nursing to outside visitors. And I know we have many friends and family who are anxious to get over and see loved ones. So that's good news there. All right, so I know Mondays are a lot of figures and statistics, but that's an important part of the process. So I'm happy to walk through the numbers and give you that numerical update of what's happening here at Regency Oaks. We will look forward to seeing you tomorrow at Tuesday Talk, and we'll have some additional information for you then. Have a great Monday, and we'll see you tomorrow.